name is Guayilan, and today I'll be doing my capstone presentation, which is healthcare career exploration. So this is my table of contents. I'm going to start with radiologist, then we'll do veterinary, and then pediatric. So radiologist. So what do radiologists do? They interpret X-rays, CT scans, MRIs, and ultrasounds. They also provide diagnosis reports. They perform image-guided procedures and work closely with physicians. Their education, they need a bachelor's degree, 4 years of medical school, and like 4 years of residency, and it's a total of about 13 years of school. So pros and cons. The benefit of becoming a radiologist is high salaries. They get paid really good. I'm not wrong, they're one of the five top healthcare career that get paid the most.
What's the average salary? Average salary for radiologists?
I don't know, sir. They have advanced technology with all their scans like X-rays and CT scans. Flexible hours. You can choose what day you want to work or like what time. And job stability. Their challenges though, it's hard working, like hard workloads. It's a lot of pressure. Risk of burnout, like I said, stress, a lot of pressure, especially when radiologists are looking at the scan results. A lot of education and training, like I said, 13 years of school is a lot for a lot of people, especially after high school. You're gonna be still in college or still in school in your late 20s or even in your 30s. In this image, that big machine is a CT scan machine. You can tell how the patient, it's light, the room is with lights and everything, but where the radiologist is at is a dark, dim room. That's because because when radiologists are in a dark room, they can see the scans and the result much better, and they can tell what's wrong in the patient. That right there is a scan of their chest, and you can tell the radiologist is looking very carefully at the scan because they can't risk making a mistake, because radiologists are the one that tells the doctors what's wrong, for the doctors can give a treatment for the patients. They support healthcare, like I said before for the picture, they need to tell doctors what's wrong with the patient. Sometimes doctor can't tell what's wrong with the patient outside, so they need to take a scan. For example, you can have a broken bone and they won't notice that until you get an x-ray. They identify emergency like strokes and fractures, and they guide treatment decisions. My second thing is veterinary. They examine animals. They work closely with any type of animals, most commonly dogs and cats. They treat and diagnose illness. They administer vaccines for your pets, perform any surgeries for your pets, and they communicate with owners. Their education is much less than radiologists, as you can see, just a bachelor's degree and a 4 year of vet school. Their benefits, they help with animals. If you like working with animals, I recommend you going as a veterinarian. They connect with pet owners. They're mostly the one talking to the owners, telling them what's wrong with their pets. Their challenges is long hours and physical work. Most of the times, veterinarians are standing. Most of the time, they're standing up, checking the pets, and emotional stress. Right here, it's a dog taking their vaccine. Like I said, veterinarians do vaccines so they can prevent any illness or disease that you don't want for yourself. How do they support healthcare? Prevents zoonotic disease, like I said before, supports food and farm animal health, and promote mental and emotional well-being through pets. My third thing is pediatrics. What do? They examine infants, children's and teens, sometimes young teens as well. They diagnose illness for all the children. They also administer vaccine for children. Bet all of us has gotten our vaccines from them. And they guide their parents on growth and develop. Every time you go to them, they always check your height, your weight. They're just checking up on you every time they can. Their education is a bachelor's degree, 4 years of medical school, and 3 years of residency. Their benefits, they build a relationship with family. Mind you, they're taking care of you since you're an infant all the way to a young teen, which is a long period of time for your life. So they're going to be connecting with your family most of the time. Improve lifelong health. They take care of you mostly. You get sick, you're going to go with them. Their challenges, treating like child. Like sometimes children can have an emotional ride, you know? They can be happy at one moment and then they can be mad the next time. Or when you're trying to get a vaccine for children and the children doesn't want to get their vaccines. It's a very hard time for them to do that. And emotional stress again. You can tell that's the mother and that's the child. And that's the doctor checking their heartbeat for the child. You can see how the child is very comfortable with the doctor touching it. You see how happy they are? That's the goal for them. They want to be comfortable with the child. They want to work with them. How do they support the healthcare? Supports child development and prevention. They provide vaccine for like your flu vaccine is the most common one. Nobody wants to get the flu, right? Nobody wants to be sick, so they're gonna give you that vaccine so they can prevent you getting that. And they also work with school specialists and public health. And that's my portfolio. You just want me to read a short version?
I don't want you to read it, just
I'll just summarize my thing. Like I said, my name is Fernanda, and at first I hated this class, and I kind of still do. I'm gonna be honest with you. I wouldn't say hate now. I would just say dislike. But it's just the class itself. I like the teacher. But
you don't have to.
no, but you're nice. The class is hard, but see, this class is the only class I actually saw myself grow, because at first I didn't like to do presentation, and I'm still not the best at it, as you can tell, but I'm working on it. And I'm also really bad with assignments. I procrastinate a lot. I do my assignment the same day or last minute even. It could be 11 and the assignment is due at 11:59 and I'll be rushing. And that's not good, especially if I want to join college. I cannot be doing all of this. I cannot be procrastinating. I can't do that. And this class taught me and showed me that I need to improve that a lot more. But honestly, if it wasn't for the workload, the homework, the stress, this class isn't really bad. I like doing practice, hand-on practice, like, you know, how he gave us time to do the vital signs, or to practice the vital signs, or time to do CPR. That's fun. And that's gonna help me more for my healthcare career. Even though I want to become a radiologist in the future, and I won't be needing all of that, there could be an emergency case where somebody is choking and somebody needs help, and you call 911, but they're not gonna get there in time. I will, like, since I done choking, I could be there to help them. My next step for this, my next step is for junior year, I want to join more science class as possible, because right now the only science class I have taken is Earth and Environmental and Biology, and I want to take more science class because science is a major part in radiologists. So I think science class can help me for that. I also want to join HOSA because I think that can help me a lot, especially to get in college. And for my senior year, I want to join EMT or FON class. I don't know yet, I'm still deciding, but I really want to join EMT. Yeah, that's my reflection, y'all.